Hi, it's Andy. I hope you're doing great. I also hope you're doing some good. We're here with Dr. Sam Sunshine at OC Sports and Wellness in Southern California, and Dr. Sunshine is a sports and wellness physician. He's going to walk us through what it takes to become a sports and wellness physician, what is all entailed, and we're starting right now.
My name is Dr. Sam Sunshine. I'm a primary care, family, and sports medicine doctor. Most people think of doctor as a medical doctor, but there's a lot of different types of doctors. You could be a doctor of English, you could be a doctor of physics. I'm a medical doctor. To be a medical doctor does require a lot of determination and persistence. The schooling is long, but it's very rewarding. And about halfway through the schooling, you are seeing patients. And that's what most students of medicine enjoy, is being able to be involved in somebody's life and help them through a difficult time. And that's what I like about being a doctor. And most people, when they are interviewed, who are medical doctors, cite that helping others is the #1 reason they go into medicine. We know that the body is a very complex organism, and we know that all the cells in our body communicate with each other. So the food we eat has an impact on our mood. A lot of people don't think about that. Or the stress that we have in our life can impact our mood or our digestion or our heartbeat. And I think it's important as we learn about the breadth of medicine and how the human body works, that we understand these communication pathways and how organs, and when I mean organs like the brain, the digestive tract, the heart, how it all communicates with one another simultaneously 24 hours a day. So it's very fascinating. I don't work in a big medical facility or a hospital, but I work in what's called an outpatient clinic, where I'm able to see my patients here in exam rooms. So it's kind of what you would consider seeing a doctor on a regular basis for colds or for an injury or for a medical problem. And what differentiates what I do from other types of doctors is that I'm in family medicine, which is a specialty where I address the problems of children as well as adults, and for a variety of reasons. I practice more integrative medicine, so I look at lifestyle choices and how those affect someone's health. And I tend to treat the whole person. So I have more of a holistic approach when I treat somebody who has, let's say, a chronic condition, like a headache, or they get bloating after meals, or their joints hurt. I like to treat my patients from beginning to end. I find with that holistic integrative approach, I'm able to help people understand what they need to do to improve their knee pain, their gut health, their headaches, for instance, and how a lot of these conditions are interrelated. That a lot of times by changing diet, reducing stress, improving sleep habits, getting people to exercise, a lot of these symptoms will oftentimes just go away. So I was inspired by my dad, who's a neonatologist, and that's a branch of medicine where you take care of newborn babies that come out premature. And that really inspired me to go into medicine, to be able to help people in a very personal way. And there's not a lot of professions where you can help somebody on that deep level. And I have found that to be very rewarding. I think a lot of doctors, medical doctors who go into the profession, like the idea of being able to help people. And a lot of doctors cite the ability to help people as a #1 reason they went into medicine. And I hear that over and over again. A lot of the public looks at medical doctors as being very wealthy, driving exotic cars, living in these big homes. And the truth is that most doctors that I know live a very simple life, and they're not extravagant. They do make a good living, but there's a lot of deferred gratification, and what that means is that you put off making money until you're in your late 20s, early 30s, oftentimes because of all the schooling. So I think it's money that is well earned. A lot of doctors do have to make very critical decisions on a moment-to-moment basis, and it's affecting people's livelihood, or it could be their life in the balance if you're an ER physician or a surgeon. Every day is very different. So when I look at my schedule in the morning, one minute I can be treating somebody who has cut themselves, the next minute I'm performing a joint injection, the next minute we're treating somebody for hormone replacement therapy. I try to educate patients because I want them to realize they'll be the doctors of the future. People who would do really well in the career of medicine are people who are okay with delayed gratification, meaning they don't want to turn 21 and start making money right away and be retired when they're 50. People also have to like to learn. If you're working in a clinic like I do, seeing patients, you've got to like to spend time with patients. There are some doctors who decide to go more into the non-clinical areas of medicine, which is research, pharmaceutical research. They might go into practices like pathology, radiology, where there's not a lot of patient contact. For what I do, it's all about patient contact. For me, it's the power of trying to influence somebody to lead a healthier life. So the people who I would advise not going into medicine are people who really aren't dedicated to their craft. You have to be passionate about learning, have to be passionate about wanting to help people. You've got to be passionate about wanting to make a difference. You've got to have determination. I mean, to get through the training does take determination. You need to be able to get along with people as well. There is a lot of diversity, and it can be high stress. So you've got to be able to handle stressful situations. After you finish your high school, you go oftentimes to a 4-year college or university. While you're in your 3rd year, if you're thinking about medicine, by now you've completed most of your chemistry and physics and math and biology. You take what's called the MCAT, which is a test that is a nationwide test. Then in your senior year, or in between your junior and senior year of college, you're applying to medical schools. Medical school is 4 years. The first 2 years are what we call didactic, which is mostly book learning. And then the next 2 years is seeing patients, oftentimes in a clinic or in a hospital. And then from there, you can decide to specialize after medical school into residency. That's really where you define what area of medicine you want to focus on. For me, I like the whole breadth of medicine. I like to be able to handle whatever comes in. So I stayed in a very diverse field. There are some people who really narrow their scope and just focus on one thing, and they are really good at that one thing. The average doctor nationwide probably makes around $200,000 to $300,000 a year. I don't like the phrase, but I think every penny is earned in medicine. Again, it's long hours. There's not really any shortcuts. You've got to see patients. If you're not a good businessman and you're going into private practice, like I do, 80% of people go out of business in 2 to 3 years. So it's not a foregone conclusion just because you're a doctor, you're going to make a great living. Joining a medical practice is what most people choose to do. There's more guarantees with salary, time off, but you generally don't make as much as if you ran your own practice. To me, it's not about the money, and I know a lot of people who go into the field of medicine to make money are very disillusioned and disappointed when they get done because the training is pretty rigorous and long.